Hi, I'm Stephanie Fritz. I'm super excited to be here with you today to share with you essential oils and using them in your pregnancy. So just a quick introduction about myself. I am a licensed midwife, also a certified professional midwife. I've been a midwife since the 80s and using essential oils since the 80s. It wasn't until 2008 when I was introduced to doTERRA that I finally felt comfortable using essential oils with my clients and their children. And prior to that, I just used them myself and with my family. But at that time, when I really felt comfortable with the certified pure therapeutic grade that doTERRA offers, now I felt that I could use them in my practice. So we're going to do just kind of a question and answer, and I'm going to ask questions that I get asked, and I'm sure that you do on a regular basis, or you may have these questions yourself. So let's just dive right in. First of all, I want to talk about pregnancy foundations, and that's going to look like what your diet is. And you know, we don't always have the best diet, and so we have to supplement. And the Lifelong Vitality is the perfect supplement for pregnancy. It's a whole food-based supplement, so your body knows exactly what to do with those supplements, with those nutrients that come in that Lifelong Vitality pack. The omega-3s are perfect for that brain activity. Plant-based enzymes are amazing. I love our Terrazyme because when we take those with food, they help us to be able to get the nutrients out of our food that we need that's perfect for our bodies. But what you might not know is when you take them on an empty stomach, they help to support our connective tissue. And our whole body is made out of connective tissue. And we're creating another human that has connective tissue. So that's going to be a very big thing to include in your everyday routine are those Terrazymes, those plant-based enzymes. And then probiotics. So when we get pregnant, probiotics, PB Assist, are one of the supplements that help support our body in its optimal immune system. And they also help our body absorb iron. So my recommendation is having a PB Assist 1 to 2 every day with a meal. The next question I'm asked a lot is, what about trim shakes? So I recommend that you get 80 to 100 grams of protein in a day when you're pregnant. And that's kind of hard to do sometimes. And so when you add trim shakes into that, then it's easy to get some of those extra grams of protein. So trim shakes are great. And the metabolic blend also helps to support those sugar cravings, because I want you to cut down on sugar. Sugar doesn't help in pregnancy at all. So if you cut down on the sugars, that metabolic blend is going to help with that. Also to help support healthy blood sugar. So when we talk about essential oils, everyone wants to know if they're safe, and they want to know how much do I use and you know, how many drops. And so I want to just touch a minute on those basics, on dosage and categories. I like to put the oils into categories. So we have a restful category, we have a digestive category, we have a pain category, and I like to there's many other categories, but that helps to give you a basic. So when you're wondering what's going on, you have a question, something's going on in my body, what oil would I use? Try and go to those categories, because you may or may not like lavender for a restful night's sleep, but there are lots of other oils to use in that category. So everyone wants to know how many drops, how many drops do I use for this or this? I have to just put a plug in for the touch oils. They are my favorite. I am loving the roll-ons, especially for young families, because there's no question they are individually diluted according to what is best for that specific oil. So you're going to get lavender that's not quite as diluted as oregano, but those are already in the perfect formulas for your young family. Let's go into essential oils and their safety. That's probably the biggest question I get asked. Which essential oil can I use in pregnancy that is safe? So during pregnancy, we are very sensitive, we're very particular about what we put into our bodies, and that includes essential oils. But I want you to know that essential oils can be very safe and effective. And it's my intention, again, just to help you really see that and understand that and feel confident in what you're using. We are extra sensitive in pregnancy, so you definitely might want to dilute. Again, those touch oils are perfect for that. And using less. So you don't need, you can just drop what you would normally use in with not being pregnant, you can drop and just use a little bit less in pregnancy most often. So clary sage is one that I'm asked about a lot. It's very relaxing, calming, soothing. It's great to help you sleep at night. But in general, I say to avoid clary sage, not because it's dangerous or not safe, but it may help strengthen contractions. And we all have contractions in pregnancy. Those Braxton Hicks, or your body is doing exactly what it's supposed to do. And we don't need those any stronger than they are already until it's time to have that baby. So I just say, don't use clary sage and you'll be just fine. In the end, use common sense. That's my 2 words that are my go-to all the time. Common sense. And use your intuition. If you're not feeling comfortable with it, then don't use it. No matter what anybody says. If you don't feel comfortable, then you can, there's many other go-to oils. So, difference between clary sage and clary calm, because clary calm is one that I say totally use that every day in pregnancy, because it is in a blend, it's much more gentle, and so you can use that freely. Even though clary sage is the #1 oil in that, it still is a much gentler form. And so it can support those hormones in a gentle way versus in a just go in and get the job done way that we want to wait to. So, one of the first complaints in pregnancy is morning sickness. That's a normal thing that most people experience in pregnancy is morning sickness. So that's often a question I get asked, what can I use to support me in this, and how can I help that nausea? Because nobody wants to go through their day being nauseated all day. So peppermint is a great oil to take internally to help with that nausea. You can also use it topically or aromatically to help. Other oils that might help are any of those oils in the digestive category. So we've got digessan, ginger, cardamom again, fennel, any of those would be great. And you can use those again, any topically in a diffuser, put it on, even just smelling it are great ways to use that. doTERRA's digestive tabs are a great way to help relieve some of those nausea issues that you might have, or even heartburn. So that's a big deal in pregnancy. Pregnancy exhaustion. Who doesn't experience that? That's one of the big things. I'm so tired. I feel like I'm drugged. I can't hardly move. I don't want to get out of bed. So this is a 2-part answer here. One of the things that helps, and I say this because I want you to know it's perfectly safe to use, is our Mito2 Max. Great energy booster to help bring up those energy levels. And again, totally safe. It's a big job growing a human. And that's what we're doing. That's a superpower that you have while you're, being pregnant. And so Mito2 Max can be very helpful. The second part of that is getting enough sleep at night. You have to get that really great restful night's sleep, and sometimes that's hard to do in pregnancy. So we have our awesome Serenity complex that is perfectly safe to take, and you match that up with the Serenity essential oil or other essential oils that are from that restful sleep category, like lavender, Roman chamomile, bergamot, frankincense. In fact, one of my favorite blends is Roman chamomile, frankincense, and bergamot in just equal parts, and you can put that in a roller bottle to make it easy. I'd put like maybe 10 or so drops of each of those in a roller bottle, fill the rest up with fractionated coconut oil, and you have that as your nightly routine just to roll on your feet at night, or on your pillow or on your hands, or just to help you sleep. But I want to let you know that those Serenity Complex gel capsules are perfect to take to help you sleep. At 28 weeks, the fluid in your body doubles in pregnancy, and so that's a lot to circulate through your body, and sometimes we get those swollen ankles or very unhappy feet. And so your citrus oils are going to be your friend then. If you just rub those on your ankles, that's a good time for your partner to give you a little ankle massage and help with that. Also, putting any of those citrus oils in your water is great. So our body needs also that extra circulation. Aroma Touch is perfect for that. Cypress is the oil in the Aroma Touch that really helps with that circulation. So if you don't have Aroma Touch, Cypress is another one that is just a single oil that you can use to help with that also. And then again, when you use those citrus oils in your water, your liver and your kidneys are doing a happy dance. They're so excited for the extra help that you've given them. Another question I get is, how can I help support my skin that's stretching so much during pregnancy? Immortelle is my favorite. It's like a powerhouse blend. Who doesn't want those single oils that are in that blend? We have frankincense, helichrysum, myrrh, sandalwood, lavender, rose. I mean, those are amazing oils. And so that Immortelle blend is going to be really great. So I usually have a couple bottles open. I'm using one on my face and especially, around my eyes to help with that appearance of fine lines. When that gets about halfway gone, then I'm going to take that little roller bottle off and put some fractionated coconut oil in there, put the roller on, and now I have the perfect tummy roll. It's diluted with some fractionated coconut oil, not because it's too strong or because I need it diluted, but more because it helps cover a larger area. And Immortelle is one that would be helpful if it went a little bit further. So that's why I would dilute that. And I recommend just rolling that all over your belly every day to help with that. It's going to help reduce those appearance of stretch marks that come normally in pregnancy. It also supports your skin on a cellular level. So that's my go-to for stretch marks. So then we have a little bit more uncomfortable issues that come up in pregnancy. Again, very normal. We have round ligaments, 2 round ligaments that are on each side of our low abdomen. And when you're not pregnant, those ligaments are about the size of your pinky. But when you reach 3rd trimester and more, they stretch to about as long as a pencil and as thin as that pencil lead. So you want to make sure that you're well supported. Even just rolling over in bed, it doesn't take an athlete to strain those in pregnancy. Like I say, even just rolling over in bed can strain those. And so you want to, first of all, be very careful and support yourself. Kind of hold your tummy as you roll from one side to the other. Or as you bend down to pick something up, then you want to, make sure that you're well supported. But sometimes that can't be helped. They get strained really easy. And so my go-to oils for that is Aroma Touch, because again, that's going to be your circulation oil, and that's going to really help with that. And White Fur. White Fur is, in pregnancy, it's one of my favorites. And for children, it's one of my favorites because it helps tremendously with discomfort and pain. So when you layer those two, when you layer Aroma Touch and White Fur right on that low abdomen, right where those round ligaments are, you're going to definitely notice some support there. We have a very large nerve that runs from our low back all the way down the back of our leg, and that's the sciatic nerve. And again, when baby is growing in mom's tummy, then that baby can be positioned just right and lay on that nerve that might cause a little bit of discomfort. And so the oil to go to for that is helichrysum. Helichrysum is a great oil for nerves. And so I have a little blend that I recommend, and again, I'm going to give you numbers, but really it's just equal parts. And so I'll do like 8 to 10 drops of helichrysum, lavender, marjoram, and Roman chamomile, and then fill the rest up in a roller bottle, and then fill the rest up with fractionated coconut oil. And that is going to be a great blend to just roll on that area, usually right about the middle of your backside, and then down your leg. And again, I'm using that fractionated coconut oil, not because those oils are too strong and need to be diluted, but because we're covering a large area. And so that fractionated coconut oil helps to cover that large of an area. There's a lot to take in when it comes to pregnancy and the oils that you can use and the oils you want to use. Prevention is a huge thing. And so really creating an everyday routine is the best way to do that. So my little everyday routine, and I say it's an everyday routine, I also encourage you to change it up a little bit. Our bodies shift, and so they sometimes, want something different. They're shifting on a physical level, and so what works one week might not work the next week, and so just shift it up and change it to something else. But on a general guidelines, 80 to 100 grams of protein a day. Definitely you want to make sure that your nutrition is up there. Lifelong Vitality every day, and I recommend the full Lifelong Vitality, but if you are only comfortable with the daily nutrient plan, that's okay too. Either one are just fine. I also recommend frankincense under your tongue every day. That helps with just in keeping us happy, as well as on a physical level, helps with the inflammatory response that is naturally occurs during pregnancy. So frankincense is another really great one just to do every day for overall well-being. As you pack your birth bag, 2 oils that you're gonna for sure want to have, if it's the only 2 you have, is Wild Orange and Balance. Those are 2 great oils that I diffuse at almost every single birth. They help with those anxious feelings and who doesn't feel anxious when they're getting ready to have a baby? That's totally normal. So both those help with those anxious feelings, just keep you grounded and help you focus on exactly what you're doing right now. Not looking back on, what it's been like, and not looking forward in, am I going to be a good enough mom, or can I do this, or this is really intense. It just helps keep you grounded in that moment. And so those 2 are great oils to diffuse, or even just put them on topically and smell them. They're the perfect oils. And then for recovery. So now you've delivered, and you have this beautiful little bundle that you're holding in your arms, but you still have to deal with some of that discomfort. And so oils to help support that are my go-to are Clary Calm, because again, you're going to have emotions that are going in circles. And so that Clary Calm is going to be very supportive. And White Fir and Lavender. Those are 3 oils that are very calming. They're going to go you would put them right on your low abdomen. And I would be prepared to, again, have that already ready. Put that in a roller bottle. I usually don't mix a blend and a single together, but in this case, it might be fine to do. Or just have 2 roller bottles, your Clary Calm and your White Fir and Lavender. Roll them right on your abdomen after childbirth to help with the discomfort that comes afterwards. I chose those oils, and they work really great, but they're all very mild. And so sometimes you might have, you have this little bundle of joy, and feet might be poking down by your belly, and so you want to make sure that you're using very mild. Deep Blue might be a great oil too, but that might be a little intense. You want to make sure that you're using oils that when especially you're having skin to skin with baby, that you don't want to have something that's a little too strong for baby. Those are all 3 mild oils that are perfectly fine. So if baby's little foot is down there and is on your belly, it's going to be just fine. Please feel free to apply those as often as needed. I mean, you can do that little roller bottle every 10 or 15 minutes if you need. That's not too much. but that's going to really help with that discomfort. Your probiotic daily, as well as enzymes, and I recommend enzymes when you eat a meal, 1 to 2 with every meal, and then again 1 to 2 first thing in the morning on an empty stomach, and 1 to 2 in the evening on an empty stomach. Those are going to be, you don't want to leave those out. And then your favorite oils at night to help you sleep. So again, one of my favorite combos is I like bergamot, frankincense, and Roman chamomile. Those are 3, and I just do equal parts of those. Another favorite of mine is balance, serenity, and cedarwood. And then if you have a little bit of problem shutting off that mind chatter at night, then I might add vetiver in there. Sometimes that's not an issue, and so if it's not, you can leave out the vetiver, but if it is, that's a great plan. So I hope that you've enjoyed seeing and hearing some of this information. I hope that it helps answer some questions that you may have had, or that someone asks you and now you can feel confident in answering those questions. Thanks for being with us.
Welcome to the Empowered Life Series. My name is Holly Lowe. I'm a Canadian founder with doTERRA, and I'm also a labor doula, a childbirth educator, and a home birthing mom of 3 beautiful kids. Pregnancy is such an adventure. We are protective of the little life we are growing and tend to be much more aware of what goes on and into our body. When I'm working with our clients to prepare them for the birth of their baby, there can be many factors at play, but 2 things remain true. Labor will start and labor will end. What happens in between is your baby's birth story. For the sake of time, let's look at the normal roadmap of labor and birth and how we can use doTERRA's essential oils to support the best journey possible through those processes. I'm also going to share a few little tips for newborn and postpartum care. There are 3 stages to labor. The first stage consists of 3 phases: early, active, and transition. The second stage is pushing, and the third is the delivery of the placenta. So let's briefly look at those first 3 phases, how we could use the oils, and what it's going to look like through them. I love to diffuse oils in the early stage of labor. Excited and anxious feelings are usually high, so grounding and calming blends are great, such as Balance or Peace. Those can also be diluted and applied topically to the spine or the soles of the feet. If labor starts in the evening or the middle of the night, it's a good idea to try and stay resting, as you'll need your energy for the more active stages. Oils such as vetiver, ylang ylang, diluted and massaged on the bottoms of the feet, earlobes, back of the neck are wonderful for this. During the daytime, it's best to alternate rest with activity. Keep it easy. And I like to use oils like Citrus Bliss, or any of the citrus oils really, are fantastic for their uplifting aroma. Active labor is when you are now where you've chosen to birth, be it at the hospital, a birth center, or at home. I like to make up a roller bottle of lavender, frankincense, and peppermint, diluted of course, to roll on the lower back, hips, or anywhere that tension is building. Massage that in with a firm touch if mom is tolerating it. This is also the stage that can present a challenge with contractions not progressing as needed. Clary sage diluted and applied with firm pressure to the inner ankles, just above the ankle bone about this much. Repeated every 15 minutes or so, or until a change is noted. That can be really helpful in supporting those much-needed contractions. Remember, as much as we don't want to hear it, they have to get longer, stronger, and closer together. Now we move into transition, and this is the fight or flight phase. A surge of hormones causes this response, and if mom is feeling supported and empowered, she'll choose to fight through it in her own way. Transition can last minutes, hopefully, or sometimes to over an hour. If you're able to diffuse at that point, using a powerful mix of frankincense and melissa is wonderful at this stage to both ground, calm, and help focus. A couple drops of basil oil as well, diluted and massaged into the temples and the back of the neck, can help mom feel renewed energy when she might be feeling depleted at this stage. Inhaling a bit of peppermint off your hands, or even sucking on a peppermint beadlet, can calm those waves of nausea that are quite normal at this stage. All right, congratulations, you've made it to pushing. You can imagine an athlete at the end of a triathlon, how depleted they are of energy. Labor can often feel this way. Depends on how it's been going, but most women are going to feel very tired and not have the motivation to continue. Being alert and able to push with renewed energy and motivation can be the challenge. I love to give the birth partner in the room, whether it's dad or a doula, a couple of peppermint beadlets in their mouth because they're the ones that are often close to mom's face as they encourage her with pushing. It not only helps with that breath factor, but also gives a bit of pep for the aroma. The Motivate Touch Roller is another favorite of mine, definitely for this stage. I like to roll it on the back of mom's neck, behind her ears, and even just a little dab on her nose if she's willing to let you. The fresh minty aroma promotes feelings of confidence, courage, and belief, which really are all important at this stage of bringing your baby into your arms. I also love to use a couple of drops of geranium oil in some warm olive oil. And this is something our midwives do quite often. It's really, really wonderful. And they use it as a perineal massage around the baby's head as they're crowning to help support the stretching perineum tissue. The final stage of labor is the delivery of the placenta. Baby's now in your arms. After that, one of my personal preferences is a mix of lavender, helichrysum, and clary sage, diluted and applied to the abdomen. If uterine massage is being done by your caregiver, this is a great blend to add. It promotes the natural function of the uterus at this stage. Now, any of you ladies who have given birth will know we're often not prepared for the care our body needs in the first 24 hours, let alone the 4 to 6 weeks postpartum we need to heal. My first baby's birth was very traumatic, and I remember saying to my older sister on the phone, "Why didn't anyone tell me that I would feel like I got hit by a truck after?" Now I make it my mission to see that every new mama can have these beautiful oils available to them for their support postpartum. My most requested item that I make for my clients is my PeriCare spray, I call it. And I like to put a little bit of myrrh, helichrysum, lavender, and frankincense into a peri bottle, just the little spray bottles, with some warm sea salt water. It makes it a really soothing blend for this tender area after birth. Using the same mixture to make peri pads, or popsicle pads as we call them, is a really great option too. You just wet a natural pad with it, place it in a freezer bag, and freeze it. Use immediately after birth to soothe the perineum and help ease any swelling. You can add 1 drop of each of those oils to a warm bath with Epsom salts for a relaxing way to ease tension after birth. Now we know feelings are running all over the place after birth, so you definitely want to have Clary Calm on hand. Roll over your abdomen and pulse points for a cooling effect on the skin and balance for those emotions. For cesarean section births, the same protocols apply, but I like to add that Immortelle Blend is an amazing gem for improving the appearance of the skin. Now, it's important to note that when breastfeeding, it's a good idea to avoid ingesting consistent amounts of peppermint oil or topically on the breast tissue. In some cases, it's known to reduce milk supply in some women. Diffusing or using sparingly is perfectly fine. Newborn care is a topic of passion for me, and to only speak briefly of it is really difficult. So I will share 3 of my favorite oils for my newborns. Remembering to dilute 1 drop of essential oil to 1 tablespoon of carrier oil is important. Balance is a blend I love to apply in the first hour or so after birth, to the spine, the back of the head, for its grounding effect, like a welcome to this world for baby. Lavender for the soles of the feet for its soothing and calming effects, and myrrh to the umbilical cord for a natural cord care option daily. Remember, newborn senses are very sensitive, so be attentive to the dilution and to the strength of aroma when diffusing as well. 2 to 3 drops in a diffuser is often enough in your baby. We used the oils in the birth of our last baby, and we're honored to be able to do a newborn blessing with them in his first few hours. So that's another nice way that you can apply them. It is such a special bonding time to incorporate them into your routine, be it infant massage or just daily care routine with your baby products you can make yourself.
Hi, my name is Sarah Van Steenkist. I live in a place we like to call Hawaii-Idaho. We live half of the year in Hawaii and the other half of the year in Idaho. I'm a registered nurse. I have worked in the hospital for 15 years until more recently when I came home to be with my kids. As a registered nurse, I worked in postpartum, labor and delivery, and then pediatrics. So I worked a lot with moms and babies and families, and it was such an awesome experience and awesome opportunity for me to get to be a part of that time in their life when they're celebrating new life and new addition, and then to support them in the times when they're struggling with their family and wanting to support their children. And so I'm really grateful for the opportunity, and I love healthcare. I'm grateful for that time that I spent there. I also have 5 kids. These are my 5 children, and so that keeps me really busy. And I found as the more children I had, the more inclined I was to want to take care of them in a really natural way. And a lot of times I didn't really know how. And I found a really big gap between what my head knew as a nurse and what my heart wanted as a mom and what I wanted for my family. So when essential oils came into my life, I knew pretty quickly that this would take me on a path that would allow me to find the balance between those two things, between my head, what my head knew, and what my heart wanted. So I teach all the time, and I teach people about body chemistry. I teach people that every body chemistry is different, and that what oils and things work for me might be different than what works for you, because our bodies are made up differently. So what I have to share today might give you a starting place. It might give you something to start your journey and some ideas that could help you care for your family. I'm going to talk a lot about oil usage for moms and how moms can use the oils with their families, with their children, and implement those into their home in a natural way. My starting place was I used the essential oils on an as-needed basis. If I had a concern, then I would reach for my oils to help me with that concern. And over time, that evolved, and it became a daily routine. And I think that's where the wellness actually came into play into our home. As I was reaching for these oils as a first case, all the time reaching for these oils, it became really clear to me that this consistent daily routine was going to create wellness in my home. And as a mom, there are 4 main priorities for health in our home. And I try to keep those in check every single day. I don't do it perfectly, but I have some tools that help me keep those 4 priorities in check every single day. That first priority is digestive health. I believe that health starts in the gut. And if we don't have a healthy gut, we have a hard time having wellness. I'll tell you a little story about this 3rd daughter of mine. She often had digestive concerns. She was often complaining about her tummy, and things would come up, and I had a hard time figuring out how to help her. And this was really before essential oils had come into my life, and we were reaching for things and nothing was really helping her. And I actually was introed to essential oils with this little oil right here. And doTERRA has done such an amazing thing and put them in a touch roller like this so that we can use them so much easier and quicker. So I really love the Touch line. But back in those days, it was a little sample of the digestive blend. And I was able to teach her how to use that oil by putting a little bit on the palm of her hand and applying it to her tummy. And the most amazing thing happened. It was such a quick result. She had quick results. She was young then, and she quickly learned that the blue bottle that started with a D was really helpful for her. And so she reached for that oil a lot, frequently, and she knew how to help herself. And that was the most empowering feeling for me as a mom, to be able to empower her as a 5-year-old to help herself and to find health in her digestion and really find relief for something that had been bothering her over time. The second thing that I have, so we use this one a lot. It's one that we reach for a lot in our home. We can take it in a glass of water. It comes in a gel cap. It has a lot of different forms, but my favorite is the Touch Roller. It's so easy. It's so quick. It's in my purse all the time. It's something that we can lean on. When you're out and about and you've eaten too much, when you're out to dinner, it just is a really great tool. The second tool that I have incorporated and loved so much as a mom with my children is the PB Assist. It's a probiotic, and it helps to boost that digestive health in your gut. And forever I was using the PB Assist supplement, and my children had a hard time swallowing supplements. So thank heaven doTERRA listens, and they created a children's line. And now, honest to goodness, we all take the children's line because it tastes like candy and it's awesome. The strawberry melon flavor is so easy to have my kids take. They love it, and it's changed the health of our digestion in our home. It really has, and it's something that we can keep in check really easily. And honestly, when I'm feeling down, when I'm feeling like I might be coming under the weather, I reach for my digestive support very first. It's the thing that I double up on. I'm reaching for my PB Assist. I'm really recharging myself in that way. So digestion's really important to our family. The second priority for our family is immune support. Obviously, when you have 5 kids going 5 different directions, they're going to come home and they're going to bring all sorts of stuff into the home. So immunity is so vital for health in our home. So teaching the kids how to take care of that in a natural way is really important to us. Having tools on the go so that we can keep them safe and healthy and boosted anywhere we go in the world, Disneyland or the grocery store, anywhere we go, post pickup, carpool pickup. I constantly have these tools. I'm able to help them stay healthy and strong. Immunity is really key and essential for every family, I believe. So there's some tools that I love the most. And again, I'm going to go back to the touch rollers. They're so easy and on the go. So we create all sorts of blends, but these touch rollers have become really our best friend. So the On Guard touch roller, and the beauty of them is they're pre-diluted, so you don't have to worry about dragging your coconut oil around. You just get to take these little pretty rollers with you anywhere you go. So I use this a lot just to kind of freshen up, and we put them on the bottoms of their feet. Traveling becomes a problem, right? Traveling, you're worn down, you're tired, you're going 100 directions, you're with a lot of people, you're in busy spaces, and keeping healthy while you're traveling is sometimes a really big challenge. And so the On Guard becomes a major tool. And I love the On Guard Touch. I also love the On Guard gel caps. And now I have a few children that can't swallow a gel cap, so I get creative. I'll just snip the top of one of the little gel caps, and I'll apply those oils to the bottoms of their feet, slip their socks on, head to the airport, and they have that extra support and immune boost as they go. We love On Guard in all its forms, and we use it every day. And I love the fact that it's so versatile, and we use it in our laundry, we use it in our toothpaste, we use it in our hand soap. So even though we're not consciously thinking about it, we're getting that support every single day. And the kids may not even be aware that they're getting that support. It just comes very naturally. We love frankincense at our house. It's our best friend, Frank, and we use him every day. This becomes our nighttime routine. I apply the frankincense to their feet, along the spine, and again, I love the pre-diluted touch rollers for that. Now, this oil has kind of weaseled its way into the front of my toolkit as a mom. And it's one that you might not be as familiar with. It's called Arbor Vitae. Some call it Arbor Vitae, tomato. You can say it either way. But no matter how you cut it, it sort of smells like Home Depot, but it is amazing. And it's an immune booster. It helps with just working through all the stuff. It really supports, and it is one that I use a lot with my children, especially my younger children. It's one that's fairly mild. I don't feel like I have to worry too much about diluting it super heavily. It's just one that's very, very mild and supportive for them, and I love applying it on the bottoms of their feet. And I have a real attachment to this oil. I think aroma and emotion kind of go hand in hand. And this one reminds me so much of having my young children and taking care of them. So I have a real affinity to the Arbor Vitae. So use this one. Put it in your toolkit. It's a great supporter. So those are my tips on immune health. The third priority for us is sleep. I always say when you sleep well, you are well. And sleep is a huge priority. If you've ever had a child, you know that sleep is a prized possession and that oftentimes it is elusive and you don't have much of it. And so taking advantage of all the sleeping hours possible is a huge priority for me as a mom. And so I have my favorites, and so I'm going to share with you my favorites. Know that there are so many options for helping you sleep well. My very best favorite every day, every night is a combination of cedarwood, and lime. I love the combo. It's amazing for me. I apply a couple drops. I'll just take a couple drops of each and put them on the bottoms of my feet. I also love to apply or put a Serenity into the diffuser. It just helps the mood, right? It helps set the mood for me to turn my mind off and to sleep well. With the kids, Serenity is a real favorite. It's warm smelling. It has that lavender and the vanilla, and it's just a very warm, comforting, like a warm blanket. So our routine at night for the children is Serenity on the feet, frankincense on the feet, like I mentioned, and then we love Breathe. We love to add Breathe into our nightly routine. That helps open and freshen and clear the mind and help to promote this really restful sleep. My husband, it also helps in the husband department. My husband can be a real noisy sleeper. And so a little Breathe applied topically to the chest. And again, I love the rollers because it takes the work out of it. And as a mom, anything that can simplify my workload, right, is a blessing, is a gift. And so these touch rollers are a gift. And so applying the Breathe topically to the chest before bed really helps to open and help him with his noisy sleeping. So it helps me sleep better and helps me be a better mom and a nicer person. So using essential oils to help you sleep well is an easy, wonderful gift to yourself. It can help you have a better day the next day. It really helps rejuvenate and revive. So make sure that one of your priorities is restful sleep. And the last thing I want to talk about is emotional health. With 7 people in our home, we have 7 very distinct personalities. And so caring for and supporting each personality on an individual basis is really important to me. And the way these little people are made up is completely different. That's one thing I've learned about being a mom and raising these little people, is that not one of them is the same as the next. And so caring for them on an individual basis is hugely important to me. And luckily, we've been given some really powerful tools to help us care for the health of our mind. And I've learned a lot in the last few years about the connection between health and emotion. And it's a really powerful connection. And so it's something that I recommend you to really focus on as you're taking care of your family and taking care of yourself. And that's one thing I want to focus on as a mom. Taking care of yourself has to be a priority. It has to be something that you take the time, in my opinion, to take that time for self-care. Because if you are stressed and you are on your last leg, it's really hard to care for the people that you're responsible for. So self-care is hugely important to me. And so we're going to talk a little about the ways that you can help yourself, the ways that you can boost that wellness in your home through emotion and through that support. Really finding balance between health and emotion. So we have, again, a ton of tools. These new emotional aromatherapy oils are a asset to you, or a very powerful asset. I work with a lot of moms on my team. I work with people that come from all corners of the world. And most of them are moms, because I'm a mom, so I attract the moms, and we've created this beautiful community. And I asked them, in preparation for this conversation, I asked them what was their thing, their number one tool as a mom. What is the thing they bring to the table that helps them so much, that really changed so much? And number one, a resounding number one, was this oil right here, this grounding blend, this essential oil that we call Balance. And it's honestly always been my favorite, and it's one that I use very often, every day, to help me be a better version of myself. So this one I love to apply to my wrists and behind my ears, and it's a good start to my day. I use it as my perfume. I use it when I need a moment in silence in my closet, and I'll just cup my nose and I'll take some deep breaths in, and it really allows me to find that silence in my day, because oftentimes I don't get that opportunity, and unless I take it and really consciously create it, it doesn't happen. But Balance tends to be a really powerful tool to help me find it. So we use this one a lot. We diffuse it, we use it topically, we put it in a roller, we take it with us on the go. It helps to ground and to create that calmness and help to alleviate those feelings of anxiousness. And and stress. And so balance is a high priority for our family. Another resounding applause comes for this blend called peace, especially with children that have needs within their emotions that are, one way or the other, that need that grounding help, that peaceful, calming feeling. Certain times of the day we might have, we're really tired or we're overly hungry and they just need some help. And peace becomes a really powerful tool for that. The bottoms of the feet, just simply opening that bottle. That's such a powerful tool, and it's so easy. Just opening that bottle and taking a deep breath in. So peace is something that I seek every day in my life, and this blend helps us achieve it in a really quick, really easy way. These emotional rollers, you can't go wrong with any of them. The beauty of it is that it says the name of the emotion right on the bottle. So there's no guessing. You can say, hey, I need a little cheer. Hey, I think I need to have a little forgiveness in my life. I love forgive. It's one that I use a lot, and I'll just apply it over my heart. It just helps to consciously think about those emotions that I'm going through and consciously make that effort. And so with my kids too, they're just like these bottles. They're so different, and they can attract and alleviate so many different things and support them in so many different ways. So, picking the emotion that you're needing to help them with. This is my favorite emotional blend. It's called Motivate. And as a mom, I need that extra oomph. Sometimes in the middle of the day, I need that oomph. I need that oomph to start my day sometimes. And this is a blend that can really help me get me going, help sustain me in that long to-do list of things that I need to accomplish. And I love what the essential oils do for my kids. It empowers them to take emotion into their own hands. Maybe they don't even think about emotion, but now they do. Now they take the time to choose to take control of that and to help that and to work through that. And that's really powerful for me. I think the thing that I take home with me every single night is the opportunity I have to connect with my children. As a mom, we might be so busy or so strung out on so many different things that we have to do that we forget to connect. And coming back to home and taking the time and creating that routine with them and taking the time to get on their level and touch and feel and connect with them on a level that they might not have gotten the rest of the day. So consciously connecting with my kids has been the biggest gift that these oils could have brought into my home. And I'm grateful for it every day. I'm grateful for my journey. I'm grateful for this ability to find a balance between my head and my heart. All the things that I know, I'm grateful for. But I'm also super grateful for the ability that I have to truly lead my home and my family with my heart and find that balance between the two. So I hope that you can find some ways to help your family create that wellness, create that daily routine, find the things that work the best for you, and find joy.
So, by way of introduction, my name is Paul Winterton. I'm a board-certified orthopedic surgeon and an enthusiast of the clinical application of essential oils as well as use in the home. And this topic of safety of essential oils is one of my favorite topics because it moves from the home into the science and, of course, into the clinic where I spend a lot of time working with patients with essential oils. You know, we owe a lot to the French tradition. My colleagues in France are the ones that have really spent a lot of time clarifying and elucidating the issues of safety, particularly hypersensitivity about essential oils. When it comes to the use of essential oils worldwide, we know there have been about 400 main essential oils elucidated throughout the history of essential oil use, and 100 of those 400 essential oils are used in a clinical setting. When it comes to testing essential oils, we know that a lot of the perfume and flavor industry spends a lot of time assessing the safety of essential oils, and that's really what we wanted to talk about. We're talking about local, topical application of essential oils and some of the effects that can have there with hypersensitivity and systemic effects in our extremities, and particularly when we're talking about our organs. When we use essential oils topically, we need to make sure that we use them in a very nice diluted manner. That is, instead of just putting pure essential oils on the undersurface of our little 7-month-old foot, we want to make sure that they're well diluted. And how I usually do that in my home or with my patients in the clinic, I usually put a little palmful of just plain scented, non-scented lotion, or what I use is pharmaceutical grade Lipoderm. And then I put 3 to 4 drops of whatever essential oil I'm using. And that particular dilution, which tends to be about 5%, is really consistent with what our colleagues in the United Kingdom, how they've been using essential oils in a clinical setting and at home for decades. And as it turns out, not only are the French using them topically, but also they move more into the oral use. And I think as a mother at home or a father, when you're working with your children, you need to know that it's very safe to use essential oils topically, and we're going to go through some of the issues. When it comes to hypersensitivity, we're talking not only the superficial skin, the integument is what we call it in clinic, or the dermis, or the epidermis, but also other parts of the body. And when we talk about hypersensitivity, we talk about the effects of essential oils on our kidneys, or what we call nephrotoxicity, to our liver, what we call hepatotoxicity, and there can be effects on our neurologic system if there are overdoses. And I think that's probably an important point to talk about. When it comes to use of essential oils in the home, you're going to be very careful to keep essential oils in a safe place. They usually come in 5 cc or 1 teaspoon bottles, or 15 cc bottles. You want to keep them in a dark place so the chemicals, or what we call the constituents of the chemicals in that essential oil, don't break down, and that they'll have a lot more shelf life. But also keeping them in a safe place so you don't have a child that gets a hold of them. Among the millions of patients or people that have had exposure to essential oils, compared to currently in the United States, we have FDA-approved medications that are used daily, but in just one day, today, there have been 10,000 untoward side effects based on that. Not a bad track record when we talk about non-FDA-approved essential oils and how we have a virtual safe record, which is great for me, not only as a father of 4 children, but also as a clinician who uses essential oils daily with thousands of patients that I've used them with. And I'm going to talk later about the use of essential oils in the clinical setting. I won't go into the biochemistry, but the toxicity or the hypersensitivity associated with essential oils are based on those essential oils that have a lot of what we call aldehydes, and that's pretty much the chemistry. We're concerned about prolonged exposure as well. Most essential oils are placed on the skin for a very brief amount of time during a massage, and often if there is a hypersensitivity to essential oils, we can usually count on treating those with some nice warm water and some vegetable oil to dilute whatever might be causing a hypersensitivity. Sometimes there can be a hypersensitivity where the people actually feel the chemical effects of that essential oils, and it's always related to an undiluted exposure. One good idea as a parent when we're dealing with wanting to know whether a particular oil might yield some hypersensitivity on our child's skin would be to take a little diluted amount, get a little Band-Aid, put a little amount on that Band-Aid, and just put that Band-Aid on the undersurface of the forearm or on the back or on the belly, and that can really be a great test. We call that the patch test. So with patients that might have some hypersensitivity to smells, you can get a specimen, put it under their nose. Some of my patients really might love floral scents, others might not. I think as long as you're very careful with your family members or your patients to just make sure that there's a serious dilution and to keep the specimens in a safe place. And that's probably an important cue to talk about the volume. When we talk about lethal doses, when we use oral essential oils, it's usually a diluted no more than 1 or 2 drops. Those who have significant response to oral toxicity are taking thousands of drops, teaspoons full. And so that's where we talk about hypersensitivity. It's really a non-issue. With regard to purity of essential oils, I think as a clinician, I expose my surgical patients to a lot of non-surgical and surgical trauma, emotional trauma, discussing surgery, post-surgical management. It's so important to me to know that the essential oils I use have been sourced in a way where they are 100% pure. And when I use doTERRA oils in a clinical setting, I know where they've been sourced, where they're pronounced pure with no adulterations or no additives. And it's often the additives in perfumes, in flavors that are greatest concern regarding developing hypersensitivity. One important thing to understand about sensitivity is the amount of time that can be exposed, and it should be emphasized that if you start noticing a hypersensitivity or a response when topically applied, that can develop over a day. Most of the time, if there is a hypersensitivity that's going to form, it can be formed over a week or a month or sometimes even years of exposure. One other interesting topic that we should mention is the synergy of essential oils, that an essential oil has constituents in it, then when they act alone have a certain effect regarding supporting one's immunologic status or gastrointestinal status. But sometimes certain constituents combined together can actually heighten the effects. And so we should be aware of synergy of essential oils when we talk about safety. One important topic that should be discussed is photosensitivity. There is a chemical constituent called furanocoumarin. And those particular types of chemicals that are usually and exclusively in citrus-based oils are the ones that are most commonly associated with photosensitivity. And so when using those particular oils, it should be emphasized to avoid a lot of sunlight or any sunlight exposure following use of those oils. Chemical sensitivity is rare, but often you'll see when using highly concentrated, typically obvious essential oils such as clove or oregano, or the third oil that most people have a real hypersensitivity to is cinnamon. Those 3 oils should be used with much care, particularly with regard to vulnerability of extreme hypersensitivity. So let's go on to the second part of our discussion and talk about drug interactions. Some of essential oils do have an interaction with certain FDA-approved medications, and I think it's healthy to know what particular essential oils can have a particular drug interaction. Let's just move briefly. I don't want to get involved with too much of the science, but in the liver, there are enzymes called cytochrome P450 enzymes, and those enzymes are the chemistry that helps us metabolize medicines that we take. And so if you have a medicine that's fat-based, a cytochrome P450 in the liver helps those medicines become water soluble, and then you can pass them out in your urine. Well, some essential oils can affect cytochrome P450s and can inhibit their effects and therefore cause certain FDA-approved medications to stay around in your system a little bit longer. So it's worthwhile being aware of that principle. With regard to platelets and antithrombotic effects of essential oils, there are some essential oils that can decrease the ability of platelets to coagulate. Also, there are some essential oils that can affect blood sugar levels, and for those patients who are diabetic, either type 1 or type 2 diabetes, there are a certain specific family of essential oils that can cause a transient bump in glucose levels, particularly with response to dermal and gastric absorption. There are essential oils that you can apply that will improve the absorptive capacity of essential oils and also can improve the gastric absorptive capacity of certain medications that you take, and it's worthwhile to know about those. One of my favorite topics with regard to essential oils is clinical application, and for about 5 years I've progressively integrated what I'm calling complementary care with my patients. One of the main, well, I would say the number one complaint that people have with traditional health care, walking into a clinic, is anonymity. They complain about being treated like a number, and they feel anonymous, and they don't feel attended to by their physician. And with application of essential oils, particularly with regard to massage and using them perioperatively, it's a wonderful way for me to help my patients through palliative, what I call comfort care modalities. Orthopedic offices can be very anxiety-provoking, and often associated with feelings of anxiety come bumps in heart rate and, of course, blood pressure. And given those difficult issues that patients deal with in my office, providing some type of way to alleviate those stressful feelings that can be soothing, and of course all the side effects of improving one's feelings of anxiety with the soothing effects of a hand and foot massage that I provide in my office have been wonderful. Perioperatively, the surgeon and the patient are very interested in a healthy healing response, and essential oils can be very supportive of our immune system, and that in turn is very helpful as we go through the process of recovery. Another interesting phenomenon is this motion hypersensitivity that some patients have around the time of surgery, and that effect can be significantly soothed by use of essential oils, and those particularly soothing essential oils that I use for this problem are cardamom, spearmint, peppermint, and ginger. As a matter of fact, the University of North Carolina has studied those particular essential oils and has really had some excellent data that shows how supportive those essential oils can be towards helping people with those symptoms. Some of my patients around the time of surgery can really benefit from the warming and cooling effects of some essential oils and how soothing that can be. And I would recommend for those particular patients Deep Blue blend that many of my patients use, as well as wintergreen essential oils, of course, in a diluted fashion. So now that I've fully covered how I've applied essential oils in clinic to help my patients, use them in the preoperative setting, in the postoperative setting, and post-surgical setting, getting back full circle now to use of them in the home. If I'm confident enough to use essential oils on my patients as a board-certified orthopedic surgeon, and just for the record, I need to maintain my board certification, and using particular modalities that would put my board certification at risk is a big deal. I'm so comfortable using them in the clinic, but also, just as importantly, with my own family. And using essential oils both topically as well as orally, some of the blends that have been virtual lifesavers at home have been what I would call the tummy tamer effects, or some of the soothing, cooling, warming effects when my family members are really struggling and really need some of the nice, lovely, soothing effects of essential oils. I can do that and be their hero dad, and it's wonderful. And of course, they come into my office and see me using it with my patients, so they kind of feel like dad's being doctor at home as well. It's lovely. But even most importantly, when it comes to the sourcing of essential oils that doTERRA utilizes, I can use those on my own family, my loved ones, my wife, my children, with confidence, knowing the purity of those essential oils are not going to compromise the safety that is so important with using them both at home and in the office.